Welcome to DC to B Revolution. I'm your host, Noah Volz, and this is where I'm helping chiropractic students think big in order to live large. Here today, I'm here with Dr. David Sullivan. He's Headache Freedom Center's chief of staff, and his passion is advancing the field of neuromodulation for migraines, headaches, and cranial neuralgias. As an author, a researcher, and a chiropractic neurologist, he's uniquely suited to provide state-of-the-art therapies that incorporate modalities from a wide range of perspectives. And the mission of Headache Freedom Centers is to provide accessible, life-changing care for those who continue to suffer without answers or relief. So, Dr. Sullivan, thanks so much for being here.
Yeah, no problem at all. Thanks for having me tonight. This is great.
Yeah, it's really a pleasure to have you. You know, you've done so much over your career, and I think it's really great that you've kind of focused in on headaches specifically. I wonder if you could tell a little bit about kind of the trajectory or the arc that led you to the point where you are today.
Yeah, sure. So, you know, like probably most of like yourself or most of your your friends that have kind of that miracle moment that led you into chiropractic. And I had that too, where I was exposed to it, and it really changed my perspective. And I thought, wow, I really, really want to do that as a career. So I was in my teenage years when that happened to me. So eventually, as I got through college, I got to chiropractic school. I'm a graduate of Logan, went there. And when I graduated in 2008, you know, I started practicing soon after that, and I was really thirsty for more. So I quickly enrolled in the CARIC program to do my chiropractic neurology diplomate, which gave me a much deeper insight into the brain, the nervous system, how it works, how to work with it. And there was kind of a series of events that really led me directly into headache specific work. Which was a very exciting time for me, and I kind of felt like my life was kind of steering me even out of my control into working with headaches specifically. And here I am, and it's been, you know, 5, 6, 7 years later, and treating headaches and other, you know, neuralgias. That's pretty much all I do day in and day out, and I love it. And it's I feel like it's my passion. For me, it's a great niche because I don't think there's any other clinic that really does exactly what I do here. And it's amazing, you know, and to see people literally come back to life, you know, from having suffered for 5, 10, 15, 20 years with chronic pain is just rewarding every single day. You know, that's what gets me up out of bed to do what I do.
Yeah, perfect. So I wonder if you could talk a little bit more specifically about what it is that you do. I'm not sure, maybe your system is proprietary, so please don't share anything that's, you don't feel comfortable with, but, maybe share a little bit of the advances in headache care that you've seen in your lifetime, and really kind of, the steps that you take with somebody to help get them the right intervention.
Yeah, of course. So, okay. So listen, there's lots of different models related to, health in general. Okay. So within the chiropractic profession, there's a good proportion of practitioners that rely on the subluxation model and, or various other, like a dis-ease model, which can be very applicable. And I don't want to discount that. However, what I see in most of the patients that come here is that they've exhausted those type of approaches and they're still left suffering. Okay, so for me, I try to take the good parts of lots of different techniques and apply those as needed, as I'm trying to solve the puzzle as to, what is the patient presenting with. Okay. So for instance, like I said about having my chiropractic neurology diplomate, that's a great foundation that I've used to be able to approach someone and really truly understand their neurology. How are they experiencing pain? Where is it coming from? What are peripheral and central factors involved in their pain? and really starting with the understanding of what's happening, and then using that starting point to apply various techniques which will be well suited to that. Okay, so like for instance, I can always rely on adjustments to help stimulate central structures, you know, in the brain. But I can tap into a lot of other modalities too, right? And a mainstay of what I use is called neuromodulation. And that's, to be honest, it's such an up and coming field. I think in a lot of ways it's going to be the future of medicine in the coming decades, because it's so, frankly, it's so it has such a low side effect profile, and it's so supremely effective. It's almost a no-brainer. And the neuromodulation involves really tapping into cranial nerves and central brain structures to stimulate them in a way to affect change and healing and growth and improvement, you know? And it's fantastic. And there's so many different ways you can use neuromodulation to help people. So what I do is I try to take each person's case and craft a specific type of treatment modality for them, you know? And like I said, we could use adjustments, neuromodulation, we could use, you know, physical therapy type rehab strategies, whatever, you know, functional medicine. I do a lot of lab testing too, to gather data on their physiology. And to me, it's all about figuring out that puzzle. I don't know. Did that even answer your question, or was that too much?
No, that wasn't too much at all. Of course, like any good answer, it created, you know, 10 more questions.
Perfect. Cool.
So, you know, kind of what I'm hearing is that, you know, what your gift has been, or what you're doing currently is, you know, really taking a lot of different modalities, taking a lot of different systems of thought, and kind of consolidating them into a framework that allows you to really find, for lack of a better word, a really personalized and individualized, you know, intervention for people. I can imagine, you know, you work with a lot of complicated cases without, you know, exposing anybody's identity. Can you kind of take us through maybe a recent patient experience that you had with a migraine sufferer, you know, and kind of walk us through the steps and the conclusion that you came to on that specific case, just so we have an example to kind of see?
Yeah. So, well, I tell you what, there was a new patient that I met with today, just you know, this afternoon. And here, this was a woman who's had 13 years of chronic daily migraines. See, now I'm on the East Coast, so she had been seen at some of the local, you know, elite facilities. Like there's Jefferson Headache Facility in Philadelphia, Johns Hopkins University Hospital in Baltimore, Cleveland Clinic up in Ohio. So anyway, what happens is these people, when they're so bad, they bounce back and forth between these, like, you know, institutions, and they get second opinions and third opinions. And by the time they get to me, they've typically tried acupuncture and chiropractic and Reiki and 13 or 14 or 15 different drugs, you know, and they've seen God knows how many different people. And if they're still in pain, well, look, man, that's a big deal, you know. So this person that I met with today had advanced so far that she had an implanted neural stimulator. And, you know, what they do is they implant, you know, a battery pack in the chest wall, and they run the leads up through to stimulate the trigeminal nerve, which, you know, if it worked, would be fine. But for her, it didn't work. Plus the fact that she was out like $50,000 having that implanted done, right? So, I mean, these are unfortunately relatively common types of cases. It's pretty sad. So anyway, you know, she came in today and we discussed her situation and how it's affecting her and what are the patterns and, you know, where is her pain located and, you know, and all that stuff. Well, anyway, listen, man, this, and true story, it sounds too good to be true, but I was able to do some trigeminal nerve stimulation on her. And within about 20 minutes, I had her down to a 0 pain level. And she hadn't experienced a day with 0 pain in like 10 years. So, I mean, it's a big deal. And like I said, it sounds too good to be true, but it's something that I get to witness every day. And it was really cool. Because it's non-invasive, right? Everything I do is non-drug, it's non-surgical, it's non-invasive. There's no side effects, and it helps people get their life back. So, you know, here I do some treatment, and she starts crying. You know, not because of pain. She's crying because the pain finally went away after all that she had been through. So that makes for a very good first patient encounter, you know, to basically prove, to say, look, I can help you get rid of this. You know, that's how I try to approach this. So moving forward, we're going to dive deeper. We're going to try to explore more about her physiology and how her pain is being driven, and investigate the chronicity of it, and why and how it's happening, and develop a treatment plan. And hopefully over the next 2 to 3 months, you know, we're going to continue working together to problem solve and continue her treatment so that we can steer it in a way where she gets her life back, you know, and she doesn't have to spend all day in bed in a dark room, you know. So that was kind of an extreme example that I had today. But, you know, day in and day out, I've got these people that come here that have, you know, chronic migraines or headaches or pain that, you know, the medications just aren't, you know, fixing, right? As if the medications could fix it. And, you know, routinely I can put people through a treatment plan of 2 to 3 months, get their life back on track. And it's great, man. I love it every time. I love it.
Yeah, I mean, that's so motivating for me as a student, you know, listening to, I think that's why every student goes to chiropractic school or goes into medical school or whatever it is to hear those kind of stories and hear that they have the tools to specifically help somebody who's been in the traditional medical model for 14 years without any, you know, maybe some minor improvements, but, you know, not enough improvement. And so, you know, what would your advice be to, you know, somebody like me who's in school, who wants to see those kind of outcomes, who wants to be able to do what you do in terms of like putting the puzzle together, right? Like, or seeing the puzzle or finding the pieces. Like, what do you feel like has been your key for really honing that skill?
Well, what I would definitely say is keep an open mind. You know, because I've been where you're sitting at as a student, and, you know, you have this desire to change the world, man. I want to get out there and I just want to like set the world on fire. And you will, and it can happen. But what you got to do is you got to keep an open mind, because like when I was in chiropractic school, you know, I had a very different mindset than what I do today. And I think that my mindset has shifted and changed through the years. So don't be so rigid into thinking that there's only one single way to do it. You know, be open to possibilities. I would also say that be curious. Okay. So if you don't come from a place where you have a rigid ideology of how things have to be, it opens you to be curious about what are the possibilities that you might not have considered. Because to be honest, that type of curiosity is what got me to where I'm at today. Because if I wasn't curious, or if I wasn't motivated to uncover things that I hadn't considered, I would probably not be where I am today. So that was really important. Another big thing is have compassion for other people, the patients that you treat. That's a really, really big deal, because the people that come to you or that are going to come to your clinic for help, like, generally speaking, they're suffering pretty terribly, you know, and you really, I would encourage you and everybody else to really develop that sense of compassion, to really kind of just step back and like consider, what have they gone through? What are they experiencing? What would that be like? Because for a lot of them that I treat, it's hell, man. It's hell on earth. So if you can come from a place of compassion to say, look, I can kind of understand where you're coming from. So let's start on the same page. This is a foundation that I can help you from. That would be a really great thing to bring to the table.
Yeah, really well put. I think, it can't be, we can't say it enough how important that openness is, how important, that compassion is. It seems like the people in this field who are really excelling are the ones who've, gone through it themselves, who've had, terrible migraines or had, long-term chronic back pain or whatever it may be. And
Sure.
That has helped, them develop their own curiosity to some extent so that, they don't get dogmatic. They don't get stuck in one way of doing it.
Yeah.
In terms of your practice, do you see it continually evolving? Or do you feel like, kind of the system that you have in place is a framework that allows you to really, work in a personalized way with anybody who comes in the door?
Yeah, man. So listen, when you get out in practice, and especially, well, let me give you kind of a comparison contrast, okay? And this is not to, I'm not trying to say one's better than the other. I just want to give you a comparison, okay? So like, for instance, there's some techniques where maybe they're really heavy on like X-ray analysis and X-ray marking and that kind of stuff. So once you go through an analysis, the analysis determines how you're going to adjust, where you're going to adjust, what are you going to do, and it's pretty rigid, okay? And I'm not saying that's bad. It's just that's one approach. In chiropractic neurology, to me, what happened was it was almost like reinventing the wheel every single time, because you have this wealth of knowledge about how the brain works, spinal cord, cranial nerves, physiology. So every single person you approach is a whole new world that you need to fit together, okay? So for me, what I've tried to do through the years is kind of like take both of those and somehow fuse them together, where every person that comes to my clinic, I'm not necessarily starting from scratch. Like, I have a specific kind of protocol that I'm going to take them through. However, that protocol is very easily tweaked to be more individualized. So it's not, set in stone. And part of that is because I want to be more efficient with my own time in the office, but also, like, I don't want to reinvent the wheel every time. You know what I mean? So I'm trying to simplify things as much as I can without being too simplistic and dogmatic. You know what I mean?
Yeah, completely. It for whatever reason, it reminds me of those like flow charts in Sousa, where it's like, if this, then this, if this, then this, and you're kind of like tracing your way down the flow chart, depending on whatever objective findings you find with each exam. So the exam kind of follows a certain rhythm, but depending on what you find, you'll go different directions for different people.
Yeah, absolutely. And a lot of that becomes second nature. And, as you've been doing this for so long out of school, yeah, it becomes second nature. And to be honest, within the first, 5 to 10 minutes of meeting with somebody, you can kind of get a sense of where they're going or where your exam is going to take you. Plus, even my paperwork and all that stuff is designed to be a screening tool. So I can meet with them on the very first time and already have kind of a rough sense of like what's going on and what are we going to do. So then your exam or your consultation or your first visit is more just to kind of like confirm, am I right? Or do I need to look at something else? And that's more for efficiency's sake.
Yeah, that makes complete sense. I'm sure with the results that you're getting that you probably have a pretty long wait list, so that efficiency becomes extremely important at that point, because that's that many more people that can be served and can get themselves out of pain,
Sure.
with your help. You mentioned kind of the certain techniques that do these technical drawings. I'm aware of one technique specifically, the Nuka technique, that has some research on migraines and the effectiveness of that upper cervical technique on migraines. Is there a lot of research in terms of kind of the functional neurology or the modalities that you're gravitating towards?
Yeah, there is. The thing about it, though, is most of it doesn't come from chiropractic research institutions. But things like using, vestibular stimulations or vagus nerve stim or trigeminal nerve stim, or heck, even so these are all cranial nerve pathways, right? And there's a lot of research in both human and animal studies that have been done within that context of neuromodulation, in the last 10 to 15 years. So, it's not like very chiropractic specific in that research, but yeah, there's a ton of it. And to me, it's like really super exciting, because it's like every month there's new studies coming out showing, that these type of treatments can affect not just headaches, but like PTSD and concussions and major depression and epilepsy and, heck, even like gastrointestinal disorders, like Crohn's and IBS. Look, I remember, when I was in chiropractic school, learning about parasympathetic versus sympathetic systems and, all how insanely important the vagus nerve is, and all that it controls in the body. And heck, I can have somebody come in for a treatment and we can tap directly into their vagus nerve and ramp it up, and you can see changes right away. So to me, that's really cool. I'm kind of impatient, when it comes to like getting good results. So I want to see things happen fast. So to me, that's really exciting. So you'll find that the research in that realm, it's only going to exponentially improve in the coming years. I don't know. Did that even answer your question? I feel like I went on a big tangent.
No, that was actually the perfect answer. That's exactly what I wanted to hear. And I know that a lot of students are going to want to know more about, your unique approach to migraines, more about neuromodulation. Where can students find out more about what you're doing?
Yeah, sure. So, years ago, I could host people here in the office. The last couple of years, I really don't have the capacity to do that like on-site learning. But yeah, if they want to send a message through the website, that's fine. I can typically answer those within a day or two. As far as like, research on neuromodulation, PubMed, or any, EBSCOhost, any of those major databases are going to be chock full of neuromodulation references. That's just a quick search. You can look, oh my God, you can even look in the news. I mean, there's neuromodulation therapies that are coming out with FDA approval for various conditions, either in the US or abroad. And honest to God, man, you could just type it into Google, neuromodulation and whatever condition you want, and you're going to find a ton of references, I swear.
Yeah, that's perfect. And in terms of the website, what is your website, just so people, go to the right place?
Sure. Yeah, that's headachefreedomcenter.com.
Perfect.
Yeah, and the phone number is there. There's a place you can submit questions through email. I also have a Facebook page for both of the Headache Freedom Centers, Harrisburg, Pennsylvania, and York, Pennsylvania. So you can check out the Facebook pages. Heck, man, I have an Instagram account and a Twitter feed, the whole 9 yards, man.
All right. You're a millennial, I could tell.
Yeah. I'm just trying to do my best, you know?
Yeah, well, we appreciate that for sure.
Yeah.
Yeah, so, thank you for just kind of talking us through your process, how you got to where you are, and then the tools that you use, day to day to really help people get the best possible outcomes. And then, providing some resources for students who get really inspired and interested and want to kind of move in that direction. And build a life like you have around, really focusing on a few specific conditions that really need good practitioners offering solutions.
Yeah, you bet. That sounds great. Perfect.
Yeah.
Sign me up.
All right. So this has been a production of DC to B Revolution, helping chiropractic students think big in order to live large. I'm Noah Volz. If you like this video, please let me know by subscribing to the channel or leaving comments in the comments section below. Always love hearing from people. And Dr. David Sullivan, thanks again for being here.
You're more than welcome. Thanks for having me.